The CDC says COVID cases are on the rise across the country, with many people in North Texas testing positive. Fox 4's Alex Boyer joins us live. Alex.
Hi, Clarice. You know, this new variant is called FLiRT, and health officials say they're seeing an uptick in visits at emergency rooms, as well as urgent care centers and hospitalizations as well due to COVID-19. For most people, though, the symptoms appear to be mild. It's another busy day at the Citra Urgent Care Clinic in University Park.
We're seeing a rise in those COVID cases.
Nurse practitioner Lisa Birch says the clinic has seen about a 25% to 30% increase in the number of positive COVID cases in recent weeks. Many people don't know they have it.
Then if they're having cold or flu symptoms, because we are seeing an uptick in COVID, definitely have them put on a mask.
The CDC says the so-called FLiRT variant is spreading across the country, particularly in the southern states where temperatures are hot, keeping more people indoors. That leads to increased COVID transmission.
Some of the same symptoms that, previous versions or mutations of COVID have had, with nasal congestion, sore throat, fever, not as much cough, which kind of throws people off.
The state of Texas stopped tracking COVID hospitalizations on May 31st, but according to the DFW Hospital Council, while the number of positive cases are on the rise, thankfully hospitalizations in North Texas are not increasing at the same rate.
If you're running even a little bit of a fever and you've got some of these symptoms, probably not a bad idea to test yourself for COVID.
Cases are expected to rise once again in the fall and winter. The CDC is recommending Americans ages 6 months and older receive an updated COVID vaccine, even if they have previously been vaccinated against the virus.
If you get infected in 1 year, you may have immunity against that particular variant, but 1 or 2 years down the road, if the virus has evolved enough, you may be susceptible again to infection.
Back at Citra Urgent Care.
So it looks like we have a new walk-in.
The staff doesn't know when positive COVID cases will begin to slow down. Lisa Birch urging folks to safeguard themselves and others.
Stay home, get yourself tested, and then, be sick for a few days. Allow yourself to be sick and stay away from those who you could spread it to.
And Birch says those antiviral medications such as Paxlovid can really help reduce the severity of symptoms, but you need to take it within 72 hours of those symptoms first appearing. Of course, like anything else, consult your medical provider to see what the best course of treatment is.